All right, so good afternoon, everyone. We had a wonderful discussion during our first session today, and excited to have our concluding session begin. My name is Mary Masterson. I am a program officer in the National Heart, Lung, and Blood Institute, and I'm also the scientific program lead for the Alliance for Community Engagement, Climate, and Health, which launched about a year ago in March 2023. Please forgive me if you've heard portions of this introduction earlier today. So during this session, two of our teams, this time from the University of Alaska Fairbanks and the University of Southern California, will speak about their ongoing studies. Following their presentations, we will have a Q&A with you, our audience. So please, as you think of questions that you would like to ask, please enter them into the chat. The Q&A session will be moderated by myself and Lindsay Martin from the National Institute of Environmental Health Sciences. The World Health Organization describes climate change as the biggest threat to human health and well-being in the 21st century. It is estimated that these climate impacts will lead to increases in the incidence of chronic diseases, including cardiovascular disease, respiratory conditions, and ultimately impact the health of all people. We recognize that populations are at higher risks of climate change alongside the cumulative exposures to multiple environmental and adverse social conditions, which can be further exacerbated with diseases within these groups. ACH is meant to stimulate community-driven sustainable strategies to address the impact of climate change on vulnerable populations disproportionately affected by disparities and modifiable determinants of health, to promote health equity. And although I do not have this on the slide, multiple institutes and centers across the NIH have an invested interest in this initiative, highlighting the importance and necessity of this mission-critical program. Our awardees are the University of Alaska Fairbanks, the University of Southern California Public Health Institute, also in California, and the University of Colorado, Denver. Within their awards, each team stresses the importance of putting communities at the forefront. Researchers, community members, and partners all co-design strategies and solutions in order to promote health equity, environmental justice, and sustained change. The ACH teams are distinct with regards to the communities that they serve and the climate impacts that they're evaluating. Yet they do share 5 core objectives for their phase 1 year 2 program, 2-year program. Specifically, the teams have been charged to support community engaged research and outreach, assess potential multi-level impacts for climate stressors, assess community knowledge, attitudes, and beliefs about health impacts of climate change. And in addition, the teams are identifying, developing, and testing feasible and acceptable community engaged strategies to enhance the adoption, integration, and/or sustainability of effective climate-related health interventions and tools. Lastly, each team has been charged to build strong partnerships with diverse climate and health subject matter experts. This has been since amended to also include the importance of community partnerships and lived experiences in order to maintain trust levels and enact meaningful climate resilience. And with that, I'm going to pass the baton on to Karsten Hofer, I believe, and Ms. Robinson. Do you all wish to take it on? And then we'll move on to our colleagues at the University of Southern California, and then a Q&A.
Okay, thank you, Mary, for that nice introduction. Can you all see a snow machine on the snow?
Yes.
Okay, good.
Oh,
So
you might want to flip the displays because
flip the displays. What do you mean?
we see
Oh,
Let me
it's
see.
fine. I guess.
Oops. Is this
Yes.
better?
Yep, perfect.
Yeah, I just had I had a second screen on there, and that apparently is one screen too many. Okay, so today, first off, my colleague, Dr. Rasmus, she's sick today. So Hannah is stepping in, our program coordinator, and she's going to help me out here as I talk about setting a course towards climate justice for Alaska Native communities and talk about the initial steps that our Alaska Alliance for Community Engagement, Climate Change and Health has undertaken in the first 9 months or so that we have had our program. And to start off, I want to talk a little bit about Alaska and give a little bit of context about the environment that we are working on, including climate change. So there is a phenomenon which is Arctic amplification of climate change, where we've seen and we are predicted to see much more drastic changes in temperatures at the high north and the low south, so to speak. So the warming is much more dramatic at high latitudes. And we have already seen or are seeing quite significant changes, such as increased coastal erosion because of less sea ice that blocks storms in the wintertime, especially, and permafrost thaw, which creates significant issues in infrastructure such as sewage system, roads, and other built infrastructures. They're built on permafrost, which is permanently frozen ground. And when that melts or thaws, it basically turns often basically into mud. So you build on a solid block of ice, and then suddenly the infrastructure becomes very unstable. So this has already been or is already happening in the high Arctic. There's, depending on what models and what data you look at, the temperature changes in the Arctic are between 2 and 7 times more pronounced at high latitudes than in more temperate climates. In addition to increased climate change, you have to keep in mind that Alaska specifically, but more in general, the circumpolar north is really big and often not really appreciate the size. So here I show a map of Alaska projected over the lower 48, what we call the contiguous 48 states. And it's basically reaching from North Dakota to southern Georgia, all the way to California, if you include the Aleutian Island chain. So it is a very diverse, really big state, and it only has 730,000 people roughly that live in Alaska. So it is sparsely populated, and it is really vast. Not only is it really big, it is also very remote. So in this map here, we have Alaska with the road system included, and those are roads that connect to the outside or major communities. So you can see basically that more than half the state does not have any roads that connect communities in these areas to the rest of the state or to the terrestrial transportation system that basically runs all the way through the Americas. So few roads connect very small, isolated, and generally underserved communities. One of the areas that we are working in is the Yukon-Kuskokwim Delta, or the YK Delta, shown here in the darker reddish brownish color. And this is one of the areas that we work on, and as we only have 10 to 15 minutes total here, we can't talk about the other regions, but this is a region that has quite a few communities the size of roughly of the state of Nebraska, with no roads that connect communities, very inclement weather and unpredictable access to communities. We were just traveling last week, and we were planning on going to one of our partner communities. We were planning on getting there in 12 hours. It took us 36 to get there because of travel delays and flight cancellations. So getting into these communities and traveling between these communities, providing services to these communities is a significant challenge. However, there's more than 25,000 people that live in this area across 58 villages with over 70 federally recognized tribes, which also provide significant administrative challenges. Something else that is unique about Alaska, and specifically the YK Delta, is that subsistence foods, so foods that are gathered and hunted and fished on the land, can make up 70 to 85% of daily diets in some households. So subsistence activities are extremely important, not just nutritionally, but also culturally, as well, spiritually, and just for general community well-being. And recent environmental disasters, including Typhoon Merbak, who came on shore about a year ago in the YK Delta and has devastated especially coastal communities with significant flooding, and the Yukon salmon crash, where fishing on the Yukon River, which is in the northern part of this YK Delta, has been severely limited to preserve stocks of fish. And that had really big implications, again, culturally, nutritionally, economically. So there's multiple forces that come challenging the traditional way of life. And that is together with chronic diseases that are increasing and other social determinants of health, together with rapid climate change. And the social determinants of health is a history of discrimination, racism within the state, and even prior. So this is just giving you some context about one of the regions that we work in Alaska. Talking about subsistence, so these are some pictures of some young people that have been working with the Center for Alaska Native Health Research, which is the center that my colleague Stacy Rasmus leads, in order to, re-engage especially young folks in subsistence activities, including fishing up here on the upper right, beluga whale hunting here, kind of on the middle left, seal hunting, moose hunting, whale hunting, and especially on the northern coast. So these activities are tremendously important, again, not just for providing nutritional value, but also maintaining cultural identity of these communities. And the rise of health disparity in Alaska Native communities is really on the front lines of this rapid imposed social and environmental change. And here's just one example of Hoopa Bay, one village in the YK Delta, where in 1928, we have traditional housing here built out of driftwood. Then in the 60s, we have a small community. And then, now in 2016, we have a much more expanded community with much more infrastructure. And these communities now have, on the one hand, more infrastructure, on the other hand, are not as adaptable because this infrastructure is much more difficult to move in case of coastal or riverbed erosion. So these are just some examples of the changes that can happen in these regions in a very short amount of time, so less than 100 years, from very traditional housing built out of driftwood all the way to quite modern facilities, especially in public works such as schools and fuel storage and things like that. So in order to address some of these challenges, we created the Alaska Alliance for Community Engagement, Climate Change, and Health. And this logo really symbolizes some of the values that we have. So on the bottom here, you see a dog team where everybody is working together, the dogs, the musher steering the sled, everybody working together to address the issue of climate change and health. And the sun rising here above the horizon is a symbol of the hope that we have in addressing these issues. The priorities of the Alaska ACE is to bring together a diverse group of community and climate health experts to prioritize indigenous knowledge, attitudes, and beliefs about climate change and its impacts on the health and well-being in Alaska, specifically rural, remote Alaska Native community, assess multi-level climate and health risks and resilience factors in rural Alaska communities. So what is there in the communities that provide resilience to these stressors to the communities? And finally, to implement community-driven interventions that build adaptive capacity and resilience and support tribal self-determination of solutions at the intersections of global climate and the health pandemics that are happening in these communities. We have assembled a team made up of myself and Dr. Rasmus as PIs, Hannah Robinson as our project coordinator, and then we have a total of 7 co-Is. 3 are scientists at the university with different expertise focused around nutrition, subsistence resources such as wildlife and fish, and then 4 community leaders in the communities that we work with that provide the community perspective. And I come more from a natural science background, and Dr. Rasmus more from a social science background. So we are really an interdisciplinary team integrating community expertise in traditional ecological knowledge presented by our community leaders and trying to merge and work together with the climate expertise that we have at the university, specifically in Arctic climate change. And with that, I'm handing it over to Hannah.
Oh, thank you, Karsten. So I'm Hannah, and I'll be wrapping us up since Stacy can't be here today. So we wanted to share a conceptual framework with you. So at the top of this, we can see disruption and vulnerabilities to traditional ways of living and well-being in the rural communities. And at the bottom, we have resistance and adaptive capacity to those changes within the communities. But the real focus of this conceptual framework is the center. And at the center, you probably see, man on a boat with a tool. But I'm gonna have to look at my notes to pronounce this tool for you guys. But this is actually an image from Amonic, Alaska, which is a community that we're working closely with for this project. And it's actually the community where Karsten and Stacy and other team members were last week. So Stacy took this picture a while ago. In this picture are actually young men that are seal hunting out in Amonic. And they're using their traditional spear throwing implements, which is called a nuhawk. And I apologize if I pronounced that wrong. But so this seal hunting, and Karsten mentioned it earlier, emphasizes the subsistence ways of living, but it also emphasizes mental health and climate change, because we hear elders speak all the times, the waves are not my friend anymore. Things are changing. And also the youth are there with them learning from the elders, which has been a really big priority that we've heard in the communities and in the meetings we had. Okay, next slide, Karsten. So we've had two meetings, one in person. And so this information came from our in-person meeting last summer. We started talking about tribal academics and agency priorities. And we had people from the tribal communities, of course, from departments here at UAF, UAA, all over Alaska. And then people from agencies such as National Park Service, Fish and Wildlife Services, and a few others. And what I wanted to show you all is that you can see that there's so much overlap from this discussions. And I was taking notes. I was like, we're listening for the keywords. And somebody's hands raised, I'm sorry.
Oh, we're going to hold questions to the end of the
okay. And we're almost done. I'm sorry. I know we're getting to 15 minutes, but so there was so much overlap. Oh, sorry, Karsten. Much overlap here. And another thing we noticed was there was a lot of focus on the traditional, on the tribal priorities at this meeting that we had. And one thing I wanted to point out, we had another meeting last October, and I added a slide, but it didn't make it to this deck. And it showed, you can see we have air quality, but we don't have water quality. And that was a huge part of the discussion last October. It was like, okay, where's water quality? Where's land quality? And the community member, he actually said to us, if you want and if you need to for your papers, your presentations, you can say environmental quality. But the communities might relate more if you say land quality, air quality, water quality. So in our new slides that we have, and we actually have a meeting this evening with our alliance, they actually say land quality, air quality, and water quality. And I think that's important for us to take that to our presentations, to our papers, and even to our policies, the wording that actually came from the communities, and not changing the wording, which language is up there as well. So I think that was the big change that came from the last meeting in our priorities. And Karsten, you can go to the next slide. And so we'll be going forward. We're going to communities. We started last week, but we're really going to start on our project. We're bringing community members to Anchorage, which sometimes is easier, less than 36 hours of travel for them. So we'll bring in people to Anchorage. We're heading to the communities to do some rankings of priorities and a lot of focus groups. And we're super excited to be really community focused and have community co-eyes on our project. And last slide. In Koyana, that's Yupik for thank you. And so thank you. These are our I don't want to say sponsors, but our partners in this project. So we appreciate the time today. Thank you.
Thank you, Hannah, for that. And that's what we have. We'll pass it on to our California colleagues.
No, Zainab, Tiffany, Jill, please feel free to share your screen. Thank you.
Sounds good. I can try sharing my screen. Saying I have to download another version of Zoom. I was having this problem earlier also.
Would you like me to share a screen? You can go.
I should be able. Let me
Okay.
try.
Okay.
Can you see it?
Yes. Great.
Okay. So
Awesome.
I'll just tell me for
Yeah,
Zainab and Tiffany.
Sounds good. All right, so hey everyone, my name is Zainab, and I'm from USC working on the place study here. And then I have my colleague Tiffany from PSRLA. So we're gonna just be talking about our study, prioritizing local action for climate equity. You can go to the next slide. So this is a brief outline of what we're going to be talking about. First, we'll introduce the project, just the framework of the project, to give a little background. And then we'll move into the different phases of our project, the first being learning and listening. So we'll talk about some conversations we've had with community members and some learning we've done on our own. And then we'll go on and talk about some resources we've been developing and then our next steps moving forward. So next slide. So this is just a brief overview of our project framework. So we will be incorporating neighborhood factors, heat and air pollution exposures, community capacity, and with an end goal of improving climate-related health disparities. And so basically our goals here are to just enhance the capacity of historically marginalized communities in LA to engage in these climate resiliency efforts, particularly extreme heat. And we want to expand our community partnerships in order to be able to advance this local climate justice framework and climate resiliency that we have by integrating community voices and using local data. And then we want to develop a community climate health plan to transform LA and move towards a more resilient city. So that is just our overall project framework. And so here are the things that we're working on, the components of the project that are going to move us towards these goals. So first, we've worked on creating a community climate crisis health working group. So meeting with leads of different community-based organizations around LA. So we meet bi-weekly and we work on designing every stage of the project in partnership with them. And so with that, we have completed a literature review and conducted several community conversations. And so this information we use to develop curriculum that we will be using for climate resiliency workshops that we're hosting in the future. And so these community conversations consist of members of the communities that are with the community-based organizations that we work with, and Tiffany is going to speak more on that later. And then we're working on developing a curriculum for these workshops based on key themes from our conversations and planning to host these workshops later in the spring so that people can be equipped with this knowledge as extreme heat starts to impact LA later in the summer. So yeah, we'll be conducting these workshops and we're hoping to have a good evaluation of this curriculum just seeing how well people respond to it and what impact it has on climate resiliency efforts in the community. And then conducting a heat survey, recruiting participants at the workshop, and just collecting some information about behavior and symptoms during heat events. So next slide. And I'm going to pass it over to my colleague Tiffany to talk more about the community partnerships.
Thanks, Zainab. Thanks for setting up the stage for our project. So yeah, we pride ourselves in working with these different community-based organizations, and the organizations you see here are based out of the San Fernando Valley, Wilmington, South and Central LA, and indigenous communities native to LA. PSRLA elevates the voice of health professionals to help shape and lead an environmental health and justice movement and policy advocacy. Esperanza works at the intersection of housing, health, economic development, and EJ to address health disparities in South LA. CBE mainly focuses on reducing pollution and greenhouse gases near Wilmington, and improves public health policies, increases the use of renewable energy, and transition to green economy. Scope provides leadership on community outreach, works with other community-based orgs, labor unions, and EJ groups to ensure that low-income communities of color are at the forefront of the green job sector. Pacoima Beautiful is another EJ group that provides education, impacts local policy, and supports local arts and culture to promote a healthy and sustainable San Fernando Valley. And SPI's mission is to build the capacity of Native nations and indigenous people throughout California. Next slide, please. And so one of the first stages of our project was conducting the literature review. We looked at general literature for climate change and extreme heat, as well as the public health impacts associated with heat. We also looked at specific impacts for healthcare systems and provider urban indigenous populations, as they are often overlooked or erased in research, and transit-dependent populations. And at the same time, we started to compile resources and services that are already available in the city of LA to help residents cope with heat. And through this process, some gaps we identified was the need for health professionals to recognize that work and employment are significant heat risk factors when preparing for and responding to extreme heat. More clinical trials are needed to be inclusive of people with disabilities to determine how medications affect their ability to thermoregulate. Some medications that could affect someone's ability to thermoregulate include diuretics and antidepressants, commonly used for people with mental and physical health disabilities. And lastly, our healthcare systems will have to prepare for extreme heat events to maintain the essential delivery of services, especially if power outages occur. As we've seen during extreme heat events, hospitals experience an influx of patients, and this really stresses the power grid. Next, please. So we wanted to also supplement the literature review with the lived experience of the community members we are working with. And so far we've had 4 conversations. You can see here on the map that 2 of them were located in the San Fernando Valley and 2 were in the Long Beach and Wilmington area. The first conversation consisted of 15 women, mainly Spanish speaking, and was hosted at Casa Esperanza, a social service organization in Panorama City. The next conversation was again approximately 15 participants, mostly women, all Latinx. And this was hosted at the Pacoima Beautiful headquarters. Here we spoke with their community inspectors program, so their members seemed very active in their community. The third was a hybrid session, approximately 12 participants in Wilmington. And our last conversation was through Zoom with the Ursula Adults Program, which educates residents on the impacts of pollution in industrial facilities and encourages people to engage in campaigns such as water rights and fighting against power plants. Next slide, please. And through these community conversations, we started to gather key themes we heard at each conversation and across all the conversations. One is that people seem pretty knowledgeable about how heat affects their health and interventions they can do at home to protect themselves, but they do feel like they need more support from the city government, or residents are just unaware of these services. So there needs to be better communication of what resources and services are already available in their area. The economic constraints varied across each community. Some of them included being rent burdened, the utility costs, the price of gasoline affecting their decision to go to a cooling center or not being able to access park and recreational sites such as swimming pools during heat days. Their communities also experience transportation barriers. Many of them lack shading structures, benches, seating areas. There's limited service routes, which can really hinder people's ability to access healthcare. Some of these individuals do not have health insurance, or their neighborhoods don't have many clinics and hospitals nearby. So the unreliable transportation just adds another barrier to actually attending their appointments. And lastly, there was an emphasis on the need for better tree maintenance programs. Although some of these trees are being planted, they often don't survive because there's no maintenance program in place. Next slide, please. And so during these community conversations, we distributed a survey to gather demographic information and a baseline assessment of how much knowledge people have about climate change or extreme heat and their living conditions. So here are some questions we asked. The first being, I or my family have personally experienced the effects of extreme heat, with the majority of respondents strongly agreeing with this statement. The next, about 61% of participants had at least one person in their household with a chronic illness, and about 60% of participants had at least one room with AC in their home. Next slide, please. And since PSRLA works closely with physicians, we thought it would be helpful to have a focus group with a panel of physicians, and we asked them for their experience with delivering care during extreme heat events or how it impacts the healthcare system. And here are some key themes that they identified. Physicians play a critical role in patient care and advocacy, and there's a need to integrate climate education into the medical curriculum. General recommendations might not work for everyone. For example, one of the general tips is to stay hydrated and drink water, but that may not be the best solution for a kidney patient who excessive water could actually hurt their health. Next, conversations must be happening with the labor and health sector to ensure workers' rights are being enforced. The medical infrastructure is not prepared for extreme weather events, and this includes medical and emergency roads that would be needed for an evacuation. Access to healthcare and clean water can be challenging, and we need to see an increase of use of informal spaces to act as emergency infrastructure or cooling centers. Next slide, please. And I will pass it back over to Zainab.
Cool, thanks, Tiffany. So now we want to talk about a couple of resources that we've developed. So we have a couple of examples here. We made a heat waves and health infographic that contains several pages translated in English and Spanish. So just provides people with general information about what extreme heat is and identifying different health impacts from extreme heat. And then in addition, we also highlight what to do if there is an extreme heat event and you don't have AC. And then catering to different populations also. So we have some pages on public transportation and how to protect yourself using public transportation during heat waves, pregnant people and heat waves, and tips for parents and teachers and students within schools. And so yeah, just a couple different infographics we've produced for people. And then we also have on our website, we have a couple different resources compiled for what to do to prepare for extreme heat and different tips and tricks as well. So next slide, and I know we're hitting the 10-15 minutes, so I'll try to move a little quicker. So we've also been developing some neighborhood resource maps. So right here you can see we are highlighting, the data is just going to be visualizing different cooling centers, parks and rec centers, sports facilities, and different water features like fountains, hydration stations, and pools and libraries. So people can kind of map out in their community where they can go to escape some of this extreme heat that may be occurring in LA. And if we go to the next slide, we have an example map as well. So this is based in Wilmington, which is where my colleague Tiffany was talking earlier, where the Communities for a Better Environment is based. We had a couple conversations in that community. So here we can see different transportation routes and cooling centers and things. So just an example of a spatial analysis map that can be used in the community to have an idea of where people can go when experiencing extreme heat. And so if we go to the next slide. And another resource we're developing is hyperlocal weather stations. So we want to use real-time weather and PM 2.5 levels to be displayed on an online data dashboard. And eventually an interactive map on our online website, so that this kind of like localized data can be used by the community and further inform climate resiliency strategies. And so, yeah, our community partners have expressed interest in locating these weather stations near schools and sports fields and things like that, so that they can inform local decisions and improve their community and particularly children's health in this way. So the next slide, just looking forward to some next steps. We're going to continue having these community conversations, particularly with urban indigenous folks and in South LA. And then developing more workshop curriculum, continuing building those maps that we just shared, and then hosting more of those workshops, and then eventually having a final tools and final toolkit and share the results with our community partners and our residents. So yeah, that's kind of an overview of the project and what we've been doing so far. This is our team right here, our lovely community partners and PIs and project coordinators, everybody who makes the project possible. So yeah.
Thank you, Zainab. Thank you, Tiffany, Hannah, and Karsten. This has been a great conversation thus far, and please feel free. I think Amrita put it in the chat. Feel free to enter any of your questions into the chat and to warm us up. We're going to have Lindsay Martin take over with questions, and I'm also going to post in the chat the websites for each of the teams if you want to take a look and familiarize yourself. Thank you again.
Thank you, Mary. Hello, everyone. Just outstanding presentation. So exciting to see the work that you're doing. While we wait for questions to come in, I have one question myself. And so, thinking about the process of engaging communities and thinking about your projects over the past year, a question for both of the hubs. What would you say is your biggest takeaway with engaging communities since you started these projects? Maybe we'll start with Alaska, University of Alaska.
Yeah, maybe I can take that one. So the biggest takeaway is really to listen to the communities, and that I have thought about this climate change and subsistence health for quite a while, and honestly, I was quite surprised in some of the priorities that were mentioned, and also the priorities that were not mentioned. So I come from an infectious disease background, so clearly infectious diseases are going to be the main point that they're going to all bring up, and they haven't, right? So I think I came in with this preconceived idea that infectious diseases is one of the most important things because of the biases that I have because of my disciplinary background, and learning to kind of listen and really see what is it that the communities really care about. And there was a lot of the cultural implications of what does it mean if I can't teach my grandson how to fish, rather than there's all these infectious diseases that are going to come in with ticks and whatnot and vectors, and that was not really a thing. So listening to the communities, what the priorities really are, and trying not to push our preconceived and sometimes very self-serving priorities on the communities was my big takeaway.
Thank you, Karsten. Turn it over to Jill and your team.
I'll start if anyone else then wants to add in. I think similar to what Karsten mentioned, it's like we decided to add this whole piece of having community conversations after initially talking to our key partners, and was like, we really need to listen and understand from the residents where they are before we start designing curriculums or surveys or whatever we want to do. And through that, I think also taking the time. So with building these partnerships with the urban indigenous populations, they said to us, like, your timeline doesn't work for us. Like, you need to slow down and we need to take it in a different step. So I think being able to be adaptive to each neighborhood and each community, and sort of have that flexibility to be really responsive to them, to kind of grow these partnerships to hopefully be sustainable in the long term. I don't know, Tiffany, do you want to add something?
Yeah, I echo what Jill said. I think that's all very important, but I would just add that it's also nice to have connections or roots in the actual communities. Like neither of us are a community-based organization, but we partner with them and we work in different coalition spaces with them. So just having this trusting relationship with them really helps with the outreach. I think if we reached out individually, maybe we wouldn't get as big of a turnout for participants, but to have someone who lives in the community and experiences the same struggles as them reach out is really helps like form those long-term relationships.
Thank you, Jill. Thank you, Tiffany. Do we have questions from our participants joining us today? Please feel free to pop those into the chat if you'd like to raise your hand. I don't see any coming in via chat. So I do have another question, and this is for USC. And so it's so fantastic how you're utilizing qualitative methods to really be able to get that deep understanding of the impact of climate change on your communities. And so you mentioned something like critically important that came up in your results, and that was around like the pressures on healthcare systems. And, it's so great to see the focus group that you had with clinicians and providers. Maybe could you tell us a little bit more about, what led to you kind of, thinking about doing that focus group with clinicians and, bringing in that health systems piece of it?
I think PSRLA and USC, we just wanted to make use of our membership based, that is PSRLA's brand, to work closely with physicians to advocate for policies that really benefit public health. And I think it also came up in conversation with like the Climate Emergency Mobilization Office here in the city of LA and other stakeholders. We realized the need to have a wide perspective of the issue to see like what resources or information would be most helpful for folks.
I think another key piece is we realize, these healthcare professionals see a lot of the impacts of heat and kind of have that different experience through that patient. So also, bringing in all their expertise into the conversation about what they're seeing. And, I think also understanding the gaps. Like one thing we've identified is like sort of worker health and safety protections and having occupational and labor sectors involved. We don't have them yet in our population, but through kind of engaging with communities and talking to physicians, we can sort of identify, right, like how we need to make the circle grow.
Thank you, Jill. Thank you, Tiffany. We have a question that came in over chat from Ashlyn Quinn. If we could have a little time, could the Alaska Center speak about the other area of Alaska where you're doing your work? Are the concerns different there? And Ashlyn notes that the work that you describe is really fascinating.
Karsten, would you like for me to jump off, or do you want to start with this one?
I can take that one. So the other communities we are working in is in interior Alaska. So if you remember the map, it's basically smack in the middle. It's that's kind of close-ish to Fairbanks. So we have two communities there. They actually the fascinating part was when we were in Immonik, which is in the mouth of the Yukon River. We had one of our community members from the interior with us, and he was talking about his village, which is Arctic Village, which actually drains into the Yukon, which then obviously flows by Immonik. So it's all connected, but the concerns are drastically different, because one is right by the coast, very, very flat, basically at sea level. The other one is kind of in the mountains, kind of higher up, where coastal erosion is not necessarily that big of a problem. Access to subsistence resources, however, is a similar problem, especially given caribou migration. And that community specifically is extremely worried about development in the Arctic National Wildlife Refuge, where the caribou herd that they depend on as a community, they consider themselves caribou people, where the calving grounds are up north in the Arctic National Wildlife Refuge. If you followed any of the ANWR, it's called controversy a couple of years ago. So I would say overall the concerns are similar, that they deal with cultural integrity of the historic practices in the communities and the health of the subsistence resource. But the specifics are very different, yet the communities are connected through this river that flows through the communities and connects them over hundreds of miles. So that's kind of it was for me fascinating to see that, again, the big picture is similar: subsistence, health, access to subsistence resources, healthcare delivery, infrastructure, but the specifics are rather different in the two communities, because the ecosystems are just so different.
Yeah, and I'll add to that. At our quarterly meeting, at first we were focused only on the YK Delta, and we expanded to also include the interior. Wildfires was brought up at the quarterly meeting because the interior people were there. So wildfires, and then very much an increase in wind. We live kind of in the interior Alaska, so wind levels can shut our power out, and it has. So I will say wind and wildfires are specifics that we did not hear so much at our first meeting when it was just the YK Delta, and when we had the meeting that included the interior. We're getting different priorities, but there's also, like Karsten says, some of the same. So yeah, thank you.
Great. Thank you, Karsten. Thank you, Hannah. That's so fascinating to hear about, that you have some of those contextual differences, but the threads that bring both the communities together. We had a question come in from Erica for USC. And so you mentioned tree maintenance barriers to urban canopy. Have you seen any funding models in Los Angeles where municipalities, electric utilities, and others provide tree maintenance services for trees on private property or areas with a deficit of tree canopy?
Do you want to
go for it, Tiffany?
Yeah, we haven't really explored the funding models behind the tree maintenance programs, but from what we've been hearing in these conversations, the maintenance often falls on the residential homes or owners who live in the area.
Yeah, and I can also add that in the community conversations that we had, that was something that community members brought up quite a bit, even mentioning that they've organized protests around trees being torn down in different places, and urging people to call city officials to ask for more tree planting. So this seems to be within the communities something that hasn't really been serving them, yeah, just trying to figure out ways in which there can be more programs, more comprehensive, and programs that actually work within the city to have better tree canopies for shade and whatnot.
Yeah, thank you all for those responses. I know it can get quite complex with tree maintenance, and and funding models and things around that. And I know I've also heard from the Philadelphia Horticultural Society, they have a saying, the right tree in the right place, and making sure when you're doing urban forestry, especially, that the type of tree is right for that environment. So thank you for sharing that. And so while we wait for additional questions to come in for University of Alaska. So I know you mentioned that your air quality was in, you had that wonderful Venn diagram, and you mentioned how air quality was in there, but the water and land quality were not in there originally. Could you expand on that a little bit and some of the community, concerns around that and how it's now being framed as issues of environmental quality?
Yeah, sure. So the initial Venn diagram that we showed in our presentation, that came out of the first in-person Alliance meeting, which was a mixture of community members, scientists, agency personnel, so managers, resource managers. And there, when Hannah was taking notes, air quality was kind of a big deal, especially about the wildfires that she mentioned. That's kind of a big deal. In Alaska, we have millions of acres that burn largely in uninhabited tundra areas and the boreal forest. And so the air quality can be quite concerning. And in the winter, we have wood smoke when it gets cold. So that was initially brought up, but then when we presented that back at our quarterly meeting, which was about 3-4 months later, in October, there was quite a bit of like, wait a minute, it's just air. It's not just air that we're concerned about. So initially, we came, like the community basically brought up that air quality was a big concern. But then when we basically presented back to the Alliance, to the community members, this is what we heard. They said like, well, yes, but there is more to that. When we see this air quality, it's bigger than that. And I think what Hannah was talking about is really important, that how we communicate the concerns that we hear. When we immediately, everybody jumped to like, oh, they're talking about environmental quality or environmental health, and that was not a phrase that connected very well. So they were more talking about like, when there's like environmental health, that doesn't mean anything to us. It's air quality, water quality, land quality. Like that was more directly applicable to the communities. And that's where that shift came from, that, yes, it's everything. It's not just the air, it's kind of everything, especially looking at contaminants, which we have lots of like old military sites in the state that often Superfund sites and are heavily contaminated and really difficult to deal with because they're in the middle of nowhere. You can't just ride a dozer out there and pick up the soil that's contaminated because you can't get a dozer out there, right? And so things are complicated, but that was the initially was wildfires, and then it expanded in the next meeting. So this is, I think, a good example of the iterative process of working with the communities, telling the communities what we understand, getting fine-tuned the verbiage so that it makes sense to the communities as well as us as university scientists that live in relatively, at least, large communities. So that's how that kind of little change in words kind of came about and expanded.
Thank you, Karsten. That is so interesting that, like you said, that iterative bidirectional communication and being able to really hone in on the correct terminology. That environmental health wasn't a phrase that really resonated with communities. I find that so interesting. It was really the quality issues around land and water quality. So thank you for sharing that.
Together with the air quality. So the air quality was still important, right? So that resonated,
Yeah.
but it was more than that.
Thank you. And I'm taking a look at the time, and this went by so quickly. We're at 2 minutes, and I know we have a hard stop at 5, so I will turn it back over to Mary to close us out.
Yeah.
Thank you, everyone.
Yeah, thank you, Lindsay, for facilitating, Karsten, Tiffany, and Hannah and Jill. Thank you all very much for presenting, and everyone for engaging in this conversation. I really love to highlight the last point that Karsten, you were raising. It's something I think that's reflective across the Alliance. The continued iterative engagements with the community to continue to refine our approaches is essential, and that's where the uniqueness in the ECH program comes from. The formative steps that we're taking within phase 1 are for this purpose. So I know it takes more time, but I really we really appreciate all the efforts that you and your community partners are doing in this process. So with that, I would like to say thank you. Amrita, did you want to say any closing remarks for the day? I think this is the end of the day. I don't know.
Yes, so we've come to the end of day one of session. So thank you all so much for joining us for this session. I think the work that's being done by our colleagues at the ACH centers is so fantastic. And so really grateful for this opportunity to learn more about the work that you all are doing. And I'm really excited for wrapping up today's sessions for the Cafe Conference. And we look forward to seeing you all bright and early tomorrow morning for our second day, starting off with a keynote from Dr. Carey at 11 o'clock. So we'll see you all tomorrow. Thank you.
Thank you for listening to us.